Today, we're going to look at the levels of dry eye care in Singapore. In Singapore National Eye Centre, there is a dedicated dry eye clinic which is only by referral. In this clinic, patients undergone a standard evaluation which includes risk factors questionnaire and clinical examination, as shown down here. Treatment of these cases depends on the level of severity, and milder cases would have, for example, artificial tears. Second-line treatment would include punctal plugs, cyclosporin and corticosteroids, and third-line treatment at this point may include the cord blood plasma, for example. Special pathways for dry eye are available at Singapore National Eye Centre. For example, patients with MGD may be offered Blafex eyelid debridement treatment, which is provided by the nurses. Patients with autoimmune disease will be co-managed by rheumatologists in the general hospital. Patients with concurrent allergies will be offered a topical mast cell stabilizer or even referral to ENT if necessary. Patients with neurosensory dysfunction may be managed in conjunction with a pain clinic and a neurologist. There are other hospital pathways involving the dry eye patients. For example, the patients from a general clinic may be referred, as well as the patients for the non-standard intraocular lens cataract surgery and patients from glaucoma. In some of these cases, a special app may be used to evaluate the risk score, especially if the patients that were heading for the non-standard intraocular lens cataract surgery. Special evaluation pathways are available for stable follow-up cases. For example, cases which did not require corticosteroids and no other ocular morbidity. So these patients can be seen by telemonitoring, which involves some imaging followed by assessment, teleconsultation. Primary eye care clinics run by trained optometrists are also available. These clinics also see patients with cataracts and stable glaucoma. In the community, there are very few interested optometric practices for the purpose of diagnosing dry eye. And in Singapore, there are also very few interested private general practitioners as well. But it is possible to form a network with some individuals who are more interested to perform the dry eye care. We've developed an app for general practitioners which involves 5 questions that can be used to screen out unsuitable cases for primary care, and also to guide them on a step care approach involving these steps here. Essentially starting with artificial tears, then progressing to a USB eye mask for eyelid warming, omega-3 fatty acid supplementation, doxycycline tablets, and eventually even traditional Chinese medicine. Patients can be referred if all the 5 steps fail to control the symptoms. With so many people having dry eye in the community, is it possible for them to take care of their own dry eye without involving the hospital or even the clinics in the community? We think it's possible. We have developed apps that allow patients to monitor their own symptoms using questionnaire scores. At the same time, we've been exploring the use of a strip called the SM tube strip that allows patients to check the amount of tear secretion.